Hello, I'm Brian Skinner. I'm here today with Dr. Christine Waldron of Women's Health Center of New England, located in Norwalk, Connecticut. Dr. Waldron's been nice enough to agree to talk with us today about the subject of urinary incontinence. This is a subject that I know nothing about. Can you explain to me exactly what this is?
Urinary incontinence is the leakage of urine. It occurs in women of all ages and is a very common problem. I would say about 50% of women are affected by this issue.
Wow, it's a big number. What are the different types of stage of urinary incontinence?
There are different types of incontinence. The most common for women is stress incontinence, and this is leaking of urine when you cough or sneeze, exercise. There's also urge incontinence, which is an overactive bladder. The muscles contract and leak urine without you giving the signal to do that. Mixed, which is a combination of both stress and urge incontinence. And lastly, which is less common in women, is overflow incontinence.
How do you go about diagnosing something like that? There's just the different types you list. I imagine it might be difficult to understand what's causing this problem.
The diagnosis can be accomplished in the office. First, it starts with a history and physical with your physician. And then the physician may ask you to keep a diary of the amount of fluids that you take in and the leaking that you're having, and come back for a special test called urodynamic testing. What urodynamic testing is a bladder exam where you fill the bladder with sterile water, and a pressure sensor with that catheter is hooked to a computer and gives some information to the doctor to help differentiate which type of incontinence you're suffering from.
This sounds like a problem that you obviously want to rid yourself of. What are the treatment options available to someone who's going through this?
There are a variety of different treatment options. Some include lifestyle changes, bladder training, physical therapy. There are surgeries and medications that can help, and also something called a pessary can also be used for treatment.
What's a pessary?
A pessary is a silicone ring that can be placed in the vagina to put pressure behind the bladder to help control the loss of urine.
Okay. I appreciate you taking the time to talk to us today about this. Special thank you to Dr. Christine Waldron of Women's Health Center of New England in Norwalk for taking the time out of her day to talk with us about urinary incontinence. Thank you.
Thank you.